It's now time for personal appeal.
You know, hair loss can take more than just a physical toll on the people that it affects, but luckily, there are more and more options out there for people who are looking to save their hairline. Dr. Scott Boden represents patients throughout the world of hair, and he's here to shed some light on the subject. How you doing today?
I'm very good, thank you. How are you, Seth?
I'm good, thanks. So first, how do people lose their hair? How do you go about losing it first?
Well, there are two main reasons that men and women lose their hair. The biggest one is what you inherit, the genetic component that you get from your mother, your father, your grandparents. And there's a component of androgens, meaning the testosterone component of a hormone.
Okay.
And so, general term for male pattern hair loss, and can also affect women, is androgens and genetic hair loss.
So I've heard that, is it your mother's father? That's the old wives' tale, is that true?
Yeah, no, there's an influence from the mother's father as well as the father's father in both sides of the family. It's a mix of genes from both sides.
And that is stress, because a lot of people say, oh, my hair's falling out, I'm so stressed. Does that have something to do with it?
Absolutely. There can be a lot of different reasons, medical reasons and psychological reasons for hair loss. The overwhelming majority of people who lose hair that I see in my practice in the Hartford area and up in Springfield are people that have androgenic hair loss. In this country, there are about 50 million men, 30 million women with hair loss.
Wow.
And it was some degree or another. Yeah.
Now, what does androgenic mean? I'm not very smart. I don't know these things.
Okay. So when we think of testosterone, that's an androgen hormone.
Okay.
Men and women both have testosterone, and men and women both have an estrogen component.
Gotcha.
So when we look at the process of hair loss over time, and it's basically can be late teens, early 20s is when you kind of reach the peak of the hair volume you'll have. Under the influence of testosterone and under the influence of genetics, the hair starts to miniaturize. A typical pattern of hair loss in men typically starts a recession in the front, maybe thinning in the crown. There's category, or there's ways of categorizing the degree of hair loss, but essentially it starts from the same pattern in most men. And women also have a diffuse thinning pattern that can develop.
Now, people, they start losing their hair much earlier in their lives, but they don't notice it until later. How long until you notice your hair loss usually?
That's a great question, Seth. So by the time people notice that they've lost a significant amount of hair, they've probably lost around half.
Really?
If you say, well, I'm looking in the mirror and I see that I'm thinning in the front, I've probably already lost half of what I started with when I was a teenager. And in terms of my practice and what I do in guiding people through treatment for hair loss, the most important thing is keep existing hair. Keep your hair that you have. Keep what you have left. If possible, use medication, use other FDA-approved therapies to keep your existing hair. And if necessary, proceed to restore your hair surgically and undetectably, essentially.
So before you get into things to help treat hair loss, are there things you can do in your everyday life to make it so that you keep your hair, using a moisturizer, for example, or something?
Yeah, no, this is important. I think, you alluded to, can stress cause hair loss? Of course, stress can have different physical manifestations. And eating well, having enough protein in your diet, adequate nutrition is going to contribute to overall skin health and hair health. Specifically, there are some FDA-approved medicines that can keep your existing hair. And we mentioned Rogaine. I'm not a proponent of a particular drug company, but this one's been approved for a number of years. Minoxidil, this is the brand name of minoxidil, Rogaine, for men and women. There's a medication that's a prescription medication called Propecia, or finasteride, and that's a tablet that you require a visit to a doctor to get that prescription. What this does is interferes with the formation of the hormone that causes hair loss.
Now, can all these products be used in men and women, or can you be pregnant and use them in women?
An excellent point. So minoxidil, which is a liquid or a foam, is safe for men and women. Finasteride, the brand name for Propecia, Propecia's brand name for finasteride, is only safe for use in men, and so it's a problem for use in women. There are cosmetic means to make your hair appear thicker. Certainly, you mentioned moisturizers or leave-in conditioners and ways I can recommend that make your hair look better. There's a product out there called Topic, and it's basically fine protein fibers that actually make your hair look thicker. So if you're going to a friend's wedding or a party where you know you're going to be photographed, you can look better for the day.
Okay. And what about things like a toupee? Is that not your line of work?
Well, no, it's not my line of expertise, but I certainly recognize if a person comes to me with advanced hair loss, and we can talk about medications to keep your hair, transplantation as a means of restoring your hair, but the expectations are such that they want a full head of hair like they never lost a hair in their life, then I would refer them to an expert in other cosmetic means like a toupee.
Okay.
I just want to mention one other thing
Yeah.
which has gotten also FDA approval for safety, and that's there are handheld laser devices, and there are laser hoods and laser caps that you can use. Laser has been shown to have some benefit as well.
That sounds exciting.
Yeah.
So if all these don't work, then there's hair transplant surgery, and that's what you perform.
That's my area of focus. Is my I did a full year fellowship training post residency to develop an expertise in hair loss and hair and scalp surgery. What it involves is not your father's hair transplant.
So it's not the same.
No.
Oh,
The old days of plugs, and I could tell someone's had a hair transplant are generations away now, because when transplantation is done today, and a large part of my practice involves this, follicles are removed from the back. One follicle is implanted at a time into areas of thinning in the front. So areas of hair loss. Go ahead, you were going to volunteer before.
I was good. So I might need some later, maybe in here, or
A typical pattern of hair loss, you're a young man, but a typical pattern is starting to see some recession in the front. We'll hold it right there with some medications. There are ways to restore this one follicle at a time, so that when you go like this, you can go out to dinner with a friend and no one's going to know you've done a hair transplant.
Wait, thanks a lot for coming in today. And, if you'd like any more information about how to manage your hair loss, visit mymassappeal.com and click on Personal Appeal.